that's the piece that we're going to talk about in much more detail in the whole session. Next slide, please. Well, how did it start? So we're going to learn about the physician, Dr. Fitzhugh-Mullen, who wrote an article in 1985, and it really began the cancer survivorship movement. He gave life, so to speak, to the whole idea of what is survivorship. We're also going to learn about the organization called the National Coalition for Cancer Survivorship that he co-founded in 1986. And that organization actually developed the definition for cancer survivor, of which almost all cancer organizations use that definition, including the National Cancer Institute. Next slide, please. Well, why is it important? Why do we care about cancer survivorship? Well, one thing is it's the phase of care that's very important for a person's well-being, because after treatment, there are effects that occur from treatment. And we've learned so much more because we have so many cancer survivors. And we've learned a lot about the kinds of things that we can hopefully prevent related to treatment and things that we can actually address and watch for or monitor for during what we call the survivorship period, which really goes through the balance of life. You'll also learn the importance of sharing your cancer treatment and your survivorship care with your primary care physician and other physicians, perhaps a cardiologist or endocrinologist, others that are part of your healthcare team. Next slide, please. Who provides cancer survivorship? Well, when we think about cancer survivorship happening after active treatment, we often think about the follow-up period, but we know that it goes through the balance of life. So it's really a healthcare team. The initial survivorship visit, you might call it, or appointment, which can be about an hour in length, is often conducted by a physician and most often really by a nurse practitioner. In most cancer centers, it's a nurse practitioner. However, for all of the services that are involved, there are so many of the healthcare personnel that are there that help with cancer survivorship care. Your physical therapist, and even within the physical therapist team, it's the lymphedema specialist. There's the dietitian, there's the speech therapist, there's the psychologist, the social worker. So all of these individuals play a major part in survivorship care. Next one, please. Then we ask, what does it involve? And cancer survivorship, as I mentioned, its initial piece is really an appointment. It's what we call the cancer survivorship visit, but it can happen every 6 months. It can happen for every year for a long time. At that visit, you receive a treatment care plan and a survivorship care plan. And then you also learn about the effects of cancer treatment. And that's a lot of what we're going to talk about in detail in Cancer Survivorship 101. What are the effects of cancer treatment? What do we monitor for, and what can we actually treat? And I gave the example here of a breast cancer survivor who might be on a aromatase inhibitor for 5, maybe 10 years. And osteoporosis is something that we would always be watching for because that is a side effect of that. Next slide, please. So as I said at the very beginning of this course or this session would be an introduction.
And that's enough about me. Next. So in Nutrition 101, you're introduced to the current nutrition guidelines for cancer survivors. As you see, those promoted by the AICR and the ACS. And I tend to focus on the AICR guidelines only because they're a bit more detailed than the American Cancer Society guidelines, but they're very similar. And ultimately, what I want the participants to be able to do is to apply these guidelines to modify their own food habits. So, and this process begins with developing what we call SMART goals. And I'll talk about that in a little bit. Next. So what can healthy nutrition and physical activity habits really do for you as a cancer survivor? Well, just a few of the things that are impacted by healthy habits are it helps the body replace blood cells and tissues that may have been broken down by treatment. It helps to keep the body strong in terms of muscle and bone. Helps to support the immune system, which defends against infection, helps your energy level. And the great thing also is that these same lifestyle habits that I talk about also helps to reduce the risk and severity of potential long-term effects of cancer treatment, such as those you see listed there: weight gain, high blood pressure, high blood lipids, type 2 diabetes, cardiovascular disease. So by applying these guidelines, you really help health overall. Next. So what are these guidelines? And I'll go into these in more detail in Nutrition 101. So I'll just give you a little idea about them now. So the first one does have to do with body weight, and that is, keeping body weight within a healthy range. And they really, have found that in addition to primary prevention of cancer, we now know that there's a lot of evidence, and it's still accumulating, about the role of obesity in cancer recurrence. So keeping your body weight in a healthy range is a really key recommendation. And there's been a link, pretty strong link shown between excessive body fat and increased risk for 11 different types of cancers. So for those who are overweight or obese, losing just even a small amount of weight has been found to have significant health benefits. Then the next one is physical activity in everyday life. So those guidelines are pretty much the same as for everybody. We suggest that you engage in 150 to 300 minutes of moderate intensity activity throughout the week. And, it should be something that you enjoy and that you will be motivated to do on most days. Diet rich in whole grains, vegetables, fruits, and beans. So that's what we call a plant-based diet, and that is what's recommended. That does not mean it's a vegetarian diet or a vegan diet. It just means that, according to the USDA, you maybe have seen their plate, but a plant-based diet just means that when you look at your plate of food, about 2/3 or more of it should be from plant sources, like your whole grains, your fruits, your vegetables. And then the remainder will be your protein and dairy products. The next one is limited consumption of fast food and processed foods. And this recommendation really is aimed at, for one thing, limiting your caloric intake to maintain that healthy weight. And secondly, to encourage the intake of more unprocessed foods, again, like your whole grains, fruits, vegetables, because they're going to be higher in vitamins, minerals, fiber, all of those good things. By processed foods, we're talking about, things like soft drinks, candy, desserts, ice cream, sugary cereals, that kind of thing. Limited consumption of red meat, which is beef, lamb, or pork, and processed foods high in and processed meat. So again, this recommendation really is trying to limit your intake of what we call solid or those saturated fats, because they're less healthy than unsaturated fats. And also processed meats, such as deli meats and bacon, and red meats contain what are called nitrates. And we know that they can convert to carcinogens called nitrosamines. So a couple reasons for that one. Limited consumption of sugar sweetened drinks, again, just trying to control calories so you can spend those calories on more nutrient packed foods. And limiting alcohol consumption. This is one that we have, a fair amount of research in, and it's actually alcohol is linked to increased incidence of several cancers, all the GI tract. So cancers of the mouth, pharynx, larynx, esophagus, colorectal, liver, breast, as well as heart disease and stroke and hypertension. So a lot of reasons that we recommend limited alcohol consumption. And by limited, we're talking about 1 drink per day for women, 2 drinks per day for men. And there are size limits on those drinks. It's like 12 ounces for beer, 5 ounces for wine, and 1.5 ounces for liquor. Next. So you have all these guidelines and things that you should include in your diet. Well, where do you start? How do you plan that out? So these are just some quick guidelines about how to plan those healthy meals. You make sure that your foods are packed with nutrients and not calories. You power up with protein, meaning you should choose a variety of lean proteins. So whether it's meat, poultry, fish, egg, cheese. Energize with grains. We focus on whole grains for the fiber, but grains all have some really good B vitamins. Cover about half your plate or more with those fruits and vegetables. And then don't forget your dairy foods for especially calcium, and if they're fortified with vitamin D is great. Stay hydrated with water, 2 to 3 liters per day, which is about 8 to 12 cups of water per day. And that depends on your activity and humidity and environmental temperature as well. So that's sometimes a hard one for people to take in enough of water. And then one of my pet peeves is portion sizes, because in America, we love our big portions. So just to give you an idea, this is a portion of spaghetti. Fits in the palm of your hand, not very high. It's not what you see at Olive Garden or any of your restaurants, I'm sure. Meat, the same thing. Palm of your hand, not very thick. That's a portion. Fruit, this is considered a small to medium fruit. So it's something that we all need to be aware of. What are appropriate portions? Next. And so the next thing we do in class is try to set goals, because, the overall goal is that we want to change our lifestyle habits, but we want to do it for a lifetime, not just for a matter of weeks or even months. So we suggest SMART goals. SMART just stands for specific, measurable, achievable, realistic, timely goals. And, we want you to set yourself up for success. So, choose realistic goals, have fun doing it, choose things that will be, somewhat enjoyable. Tracking your progress is really important. It does help you to be more accountable for your behavior. And lastly, with everything, reward yourself, not with, pie or something like that, but rather in this case, maybe when you reach your goal, take a cooking class with your friends, or join an exercise facility, or something that you would enjoy that would help also to keep you on track would be great. Next. And this is just a worksheet that when you attend this session, you will choose a goal and you'll write your own SMART goal during the class. So just to give you an example of a SMART goal would be, over the next month, I'll walk with my coworker for 15 minutes on our lunch break 3 times a week. So that's how specific it is that you really want to be, so that you really have in mind what your goal is. Next. And lastly, there's a lot of unreliable information out there about nutrition, whether it's newspapers, magazines, books. So I wanted to end just with some reliable sources of nutrition information. One thing I would say is look for reliable authors, which should be health professionals with credentials and expertise, and reliable institutions. And if you're looking on websites, as you'll notice these, look for the ending of the website to be .org, .gov, or .edu. In general, those will be your more reliable websites. Thank you, and I hope to see you in Nutrition 101.
Dr. Reigle and Dr. Brehm both talked a little bit about some of the physical things that go on with your body, and I'm here to talk about our social and emotional well-being. So sort of that mind and spirit component. of your cancer wellness. So we know that anxiety and depression impact many, many people, um, particularly in the cancer population. About a quarter of cancer patients are diagnosed with significant depressive symptoms or major depression. And that's a lot of people when you consider that there are over 1.6 million people diagnosed with cancer each year. And an even better news is that there are 15.5 million people who are in survivorship. So what that tells us is lots of people live with cancer. But out of those folks, about a quarter are struggling with some kind of depressive situation. And we see this equally in men and women. And we know firsthand from our own population here at the cancer support community, anyone who's been with us for a while, you've probably done the cancer support source. So it's our way of distress screening folks. And we know from our own tracking that about a quarter of our population were at risk for depression or anxiety. So this is not a phenomenon that just happens other places. Here in cancer support community, we see that 25% of our population is experiencing these things as well. Next slide, please. So how do we know if we're looking at anxiety or depression? And oftentimes this will come up in my groups. Well, how do I know if I'm not, how do I know if this is just me feeling down or a little blue or stressed out? Because I mean, I have cancer. It makes sense that I'm stressed out. But how do we know if it somehow goes from what we would call typical worry or being down into more diagnosable anxiety and depression? So if you, I know the print is a little small on the slide, but anxiety and depression often can be interchangeable in the way that they present. So some of the things we look for is uncontrolled worry, fear, dread, or uneasiness, irritability and anger, and that can be an anxiety or depression, feeling restless, muscle tension. You might notice that when you're sitting, your shoulders are really tight. And if you take a minute to sort of shake that out, you might have been holding that tension and not realized it. Low energy levels, problems concentrating, problems with sleeping, GI issues are pretty common. An ongoing feeling of just like, why am I doing this? Having a hard time being interested in things that you used to have fun or enjoy doing. Sometimes there are physical problems that you can't attribute to anything else. And I know that in the cancer world, sometimes that's hard. Is this headache a side effect from one of the medicines I'm on, or is it because I'm worried about this treatment, or sometimes it's hard to tease out. So these are always good things to bring forward to your medical team. Sometimes, in extreme situations of anxiety or depression, there can be frequent or recurring thoughts about death or suicide. And I think it's important to understand this is beyond sort of the existential worry that comes with having cancer of, is it my time to go? Am I going to die from this? That's different from, I want this to be over. I want to die. I'm going to kill myself. But I think anytime you're experiencing those things, it's important to talk to your doctor about it. There are many chemical things that happen in your body that can trigger these feelings. And if you're having any of these symptoms currently, it's important that you would speak with your doctor, or you can contact us at the Cancer Support Community and you can talk with one of our social workers and we can help you work through that. Next slide, please. So when is it more likely for people experiencing cancer to experience anxiety and depression? So good news, bad news. There's lots of different times this can happen. It's not necessarily that you're going to feel these things at every single one of these transitions in care. But it's good that we know that it's during what we call transitions of care. So the initial diagnosis, when you're starting a new treatment, when you're waiting for test results, and when you're getting those tests, laying in that MRI machine is not necessarily comfortable and can really be anxiety provoking. When you find out that a course of treatment wasn't effective, and so maybe you need to do something different. Those all, and if you think about that graph that Bev showed us at the beginning of the different phases of cancer care, each of these times of risk for mental health concerns comes up during those transitions of care. And ultimately, even during survivorship, it is not uncommon for people to experience anxiety or depression because there's this thinking of if and when my cancer returns, and also finding a new normal, and how your relationships, how everyone adjusts to you living life after having had cancer. And because that looks different, there's an adjustment period that can cause some anxiety and depression. Next slide, please. So what happens if anxiety and depression go unaddressed? So we know that ignoring these symptoms can negatively affect your treatment outcomes. So a lot of the programming we do here at Cancer Support Community, we have research that shows us when our mind and spirit are working together with our body, our bodies tend to cope with treatment better. There can be a decrease in quality of life. So that can mean maybe you're having those physical symptoms of not sleeping well, or you're eating poorly, but it also can be struggles in your relationships, and how you feel about yourself. And it can increase the healthcare costs. You know, if you're so depressed that you can't get out of bed every morning, maybe you're missing appointments. Um, you know, and maybe you put things off that need more treatment down the road. So that is a lot of things to think about. And the Coping with Anxiety and Depression program that we will be putting on is going to address a lot of ways to, one, recognize depression and anxiety in yourself, and also ways to address those issues. Next slide, please. And finally, making meaning of the cancer experience. So this is really, and I mentioned earlier, sort of the existential part of cancer. And that's really thinking about, what is the meaning in all this? Why is this happening? Why am I experiencing this? So we will have a making meaning, or meaning making program, easy for me to say, in the spring, to talk more about this. And you may say, well, what do you mean make meaning out of this? So there really is a couple ways to look at this. So part of it is the positive pursuit of cancer. And that's just a fancy way of, what's the silver lining of this cancer experience? And certainly no one would expect you to say cancer is the greatest thing that happened to me in my entire life. But it might be, but maybe there are small things that came out of that you're able to identify, that help you look at your cancer in a more positive light. Loving your cancer journey. So being at peace with the cancer journey. So what are some ways that we can help ourselves be at peace? Sort of that mindfulness of accepting ourselves in the moment where we are. And then finally, post-traumatic growth. So what is that? So post-traumatic growth is sort of a culmination of all of these kinds of ideas of gaining a sense of feeling more competent and having a sense of gratitude, regardless of what situation we're faced with. So we do have an activity for post-traumatic growth to give you a little taste of what exactly we mean by this meaning making. Jen, do we have that activity queued up?
We sure do. I'm going to go ahead and launch it now.
Fantastic, thank you. So if you all wouldn't mind answering your poll here that popped up, this will give you an idea of what we mean by meaning making.
Give people a few minutes, and
Okay,
are you able to see the poll, Georgia?
I can.
Great.
Oh yeah, I can do it too. All right.
Yeah, if you'd like. Oh, we're getting some answers. Great. Thank you so much, everyone. So we'll give it about another 20 seconds or so to get some answers, and we'll end the polling and see what our results were.
Get out. No. Go ask your dad.
All righty. Okay, so Georgia, I'm going to hand it back over to you to look over these answers and reviews that we got.
Okay. So while those are popping up, so each of those questions had to do with what's called a domain or an area of post-traumatic growth. So really the way to think about this is the flip side of post-traumatic stress disorder. So often we've heard that talked about, residual effects of when one felt their life was threatened. So post-traumatic growth is how do we grow and have a, I don't want to use the word positive, but be able to find something meaningful and something that helped us in our own personal journey out of an experience that may not be ideal. Okay, and then Jen, I'm still on that meaning making slide. Do we have a poll summary?
Yes, I'm going to hit the share results, and then you should see now the results from the poll.
I do. So it looks like from everyone who's answered, so 85% of you have experienced embracing new opportunities, both on the personal and professional front. 85% of you have I can't talk, experienced improved personal relationships and increased pleasure derived from being around the people that you love. So really enjoying your relationships more. 85% of you have had a heightened sense of gratitude toward life altogether. 62% of you have experienced a greater spiritual connection, and 77% have experienced increased emotional strength and resilience. So that shows that in this population, even in our intimate group this evening, we can see that many of you have been able to find strengths in yourself that have developed from having cancer. So I would encourage you to check out this meaning making program. This is an area that I've studied a little bit in my PhD work. And from what I can see, it is helpful in moving through the challenging experience of having cancer. It can be very empowering. All right, thank you.
All right, thank you, Jen. Let's see. Okay. Hi there, I'm Emily Morgan. I am a certified personal trainer. I'm also a certified cancer exercise specialist. I embarked on that part of my career about 3 years ago when I had my own experience with breast cancer at the age of 40, and have since then been working with clients with cancer. So I'll let Jill introduce herself when she gets to her first slide. But the topics for our Move 101 for next year are exercise and rehab. What do I need? A big question that everybody faces when they're given the go-ahead to exercise or given the little push to get moving a little bit more. Lymphedema, functional fitness, and pelvic floor, the foundations of fitness. And as in all of these topics from the other presenters as well, we're all going to be touching on cancer-related fatigue with all of these topics throughout the year. Next slide, please. Okay, so a big question that we always face after surgery or during treatment is whether we need therapy or an exercise routine or both. We'll explore the need for physical or occupational therapy to regain range of motion, balance, posture, and flexibility, and when and how to develop an exercise routine. And this can be a very exciting, but also very daunting experience for some people, whether you're an avid exerciser or you need to start incorporating more exercise into your routine. We want you to be able to do it safely and also have fun with it. So we will get into that a little bit more. And I'll pass this one off to Jill.
Okay. Hello, good evening. My name is Jill Sherlock. I'm a physical therapist. Been in practice a very long time. And been working with cancer patients for the last 10 plus years. So one of the segments of our Move 101 series is the lymphedema, a whole hour on lymphedema, what it is, how to recognize early signs of it, how to manage it, and that's what goes into doing that. but just for today, so that everyone is on the same page, lymphedema is an accumulation of the high protein fluid when the lymphatic system is impaired. So if you want to go to the, I think this might be the only slide. Never mind. 35 to 45% of people who are treated for breast cancer will have edema somewhere along the line. And it to swell when we have an intervention is normal, but to stay swollen is not normal. So that's where the lymphedema definition comes in. The edema post-surgically in any body part is caused by changes to the venous system, right? Our blood flow changes and things like that, because there's been an interruption in that. But when that fluid accumulation with the excess protein, the proteins that are normally in the fluid get stuck in the tissue and then attract more fluid. So then the problem gets bigger and becomes something that needs to be treated on its own. So whether you've had surgery, radiation, or chemotherapy, those all individually place you at risk. And if we combine those, then the risk is just exponentially greater. Retrospective research shows that 80 to 85% of treatment-related lymphedema happens in the first 3 years after the cancer treatment interventions. So it's important that people understand, and it isn't always just immediately after you've had one of those interventions, but it can come on up to, on average, 3 years later. So you need to know what your risks are, what the early signs of lymphedema are, what you can do to prevent it and manage it, and then how to access care if it becomes outside of your control. So our lymphedema expert will spend, like I said, spend that hour talking about all of these facts and giving you the tools you need to understand it and to know when and how to ask the questions, what to expect. And not just with breast cancer, but any body part that has been exposed to any of these cancer treatment strategies is at risk for that. So everyone could benefit from knowing that. Our next slide is Emily.
Okay. Functional fitness. So performing our daily tasks. What we'll be spending some time with on this segment is giving you actual physical fitness tips and specific exercises to help you perform these daily tasks that are affected by our range of motion, our balance, our strength, and our confidence even. For instance, bathing. We might give you some specific exercises to help you push yourself out of the bathtub. Grocery shopping, that's a great example. Reaching overhead, reaching for something off of that high shelf at the grocery store. Walking the dog, working on our core strength and our balance. Playing with our grandkids, that's a great one. Just showing you some functional, safe exercises that you can do on your own to practice getting up and down safely. And traveling, which we'll all be hopefully doing sometime in the near future. Using the stairs, your stamina, walking through the airport, things like that. So this should be a pretty hands-on segment that we have in our Move 101 activities. So yeah, we'll be giving you some actual physical things that you can do to regain these range of motion, balance issues, and strength issues. Okay, I'll pass the baton on to Jill one more time.
Okay, we have a segment on talking about the pelvic floor and how it's the foundation of that balance and activity energy level that Emily was just talking about. If you've had surgery or radiation in the abdomen or the pelvis, this seems like a pretty obvious, most people can make that connection, but also just being relatively inactive can lead to pelvic floor issues. Past medical history that doesn't necessarily directly relate to your cancer diagnosis, but if you've had prior history with issues, it can all be exacerbated by the treatment effects, the inactivity, the change in your daily habits. So we have a pelvic floor specialist who will spend a session talking about understanding how the pelvic floor is important and how we address it, how you can do things and to address the issues, but also when to seek professional help. Physical therapists and occupational therapists take extensive training post-graduation during their treatment lifetimes to be really experts in this area, and they have a lot of things that they can help to make life better and to give control back in some of these areas. So that is in our pelvic floor section. And then we should have another slide or two. So we mentioned earlier that we will be talking about cancer-related fatigue throughout all of the segments, and the actual definition, the formal definition is up there on the screen. We just want to make everyone aware that it is absolutely normal for cancer patients and survivors to experience fatigue. Statistically, 70 to 100% of patients will experience this cancer-related fatigue, excess, disproportionate fatigue during treatment. But 30 to 35% will continue to experience this for months or even years after their treatment has ended. And it's pervasive and impacts every part of your life. So throughout this series of the whole educational 4 pillars that we've described today, we'll be talking about ways to address that. And exercise, movement is one thing to do. One more slide, I think, Jen. Energy conservation techniques, which we'll be doing in the functional fitness category. How may I do things differently? Pacing, getting proper sleep, stress management techniques, all of that combined can help mitigate some of the fatigue and help people get on with being as active as they'd like to be. So we'll be discussing all of that throughout all of these segments that you'll from all of the experts on this panel.
All righty.